how are you?
We are here today in front of Congressmember Kevin McCarthy's office to deliver a message. We want to tell the Congressmember to protect our health care. We are here today to fight for our care. We have heard that the Congressmember is on board with plans to get rid of Obamacare altogether, and he's fine doing that without a replacement. What would that mean? That would mean that millions of people who have gained coverage under the Affordable Care Act, whether it's through Medicaid or through private insurance through the exchanges, will lose their health care. We're talking about 30 million people nationwide. In California alone, there are 3.5 million people who have qualified for Medi-Cal who didn't qualify before because they didn't have any dependents. That is in danger of being taken away. That's what we call the Medi-Cal expansion. And there's another 1.3 million people who purchased their health coverage through the exchange, through Covered California. 90% of those people receive subsidies that enable them to afford their coverage. That's in danger of going away. So as you can see right there and then, we will be going back 8 years ago when California's uninsured population was over 8 million. We have cut the uninsured population in half through the Affordable Care Act. The Affordable Care Act has saved people's lives. We are talking here about an issue that is life and death for people. And we want Congressmember McCarthy to come out, show his face, because we want him to see the real faces of people, of his constituents, of his community. And we want him to tell us to our face that he is fine taking away coverage without having a plan that will replace the Affordable Care Act. His Congress members have had 6 years to come up with a plan. 6 years. And they don't have one yet. Yet, as soon as a new president is inaugurated, he wants to hold a vote to repeal the Affordable Care Act. And replace it with what? Nothing. So people, in the meanwhile, will wait and suffer and lose their coverage. And again, you will hear from stories of constituents that we have here today who have gone through life-threatening illnesses, cancer, debilitating strokes, heart attacks, who owe their life to provisions that were put on by the Affordable Care Act. So we are here to deliver a prescription for health care. And we're here to also deliver happy and healthy New Year's cards signed by Congressmember McCarthy's constituents. And again, in order to put a face to this issue that we are facing, because it is life and death for folks.
We are gathered here at this very busy time of year, the week before Christmas, just days before Christmas, when we're all so very busy. We're all anticipating a big holiday to come, this baby that's going to be born. But I want us to keep in mind that this baby grew into a man who cared very much about health care and healing, and spent a lot of his time trying to make sure that people were healed. Seems to me if we're going to honor his birth, we should follow his example and also be there for one another with health care. The greatest gift people say they can get ever, the greatest gift they can get at Christmas is their health. Kevin McCarthy, my representative, has the ability to provide the greatest gift for his constituents this Christmas. Kevin McCarthy, you can do this. You can provide the greatest gift, keeping health care for your people Don't abandon us and be the Grinch. Follow your faith.
I feel very fortunate that through my work, I get to meet hardworking people on a daily basis. I also feel very fortunate that we can connect them to healthcare. I feel fortunate that my daughters can stay on my employer-sponsored coverage until they turn 26. I feel fortunate that we will not be denied care because we have pre-existing conditions. Now legislators are talking about repeal. Repealing is easier and faster. We forget that we are talking about people here. We are talking about people's lives. Repealing the Affordable Care Act and leaving people without access to care is irresponsible. It's inhumane. There are people who depend on this coverage, and unfortunately, some of them don't have months, they don't have weeks, they don't have days to wait for an alternative. There are people that need medication today. There are people that need chemotherapy today. There are people that are waiting for that surgery that will relieve them from their pain today. Do not take away their access to health care. For many of our neighbors, this decision will be a life and death decision. Don't take their health care away.
I have pretty much lived with chronic illness for my entire adult life. I was diagnosed with a rare and incurable form of hepatitis at the age of 19. I've been on immunosuppressant medications ever since. Immediately after graduating from college, I became a professional educator, and I enjoyed great healthcare benefits from San Francisco Unified and Los Angeles Unified School District. This coverage carried me through several disease-related procedures, years of prescription drugs, and eventually a liver transplant in 2001. But in 2012, I decided that it was time for a career change. Thankfully, I was able to give up my teaching job and pursue employment in the nonprofit sector. Due to the Affordable Care Act, while I was between jobs, I was able to take advantage of healthcare coverage. And now I'm happily and fully employed at the Dolores Huerta Foundation, following my dream of pursuing social justice through community organizing. I am fortunate now to have healthcare coverage provided by my employer. However, achieving this important milestone in my life would not have been possible if it were not for Obamacare. My ongoing medical issues require frequent, specialized medical care and a daily regimen of anti-rejection drugs and other medications. Unfortunately, this just genetic disorder, as I mentioned, is not curable. It's something that I'll live with for the rest of my life. It's degenerative, and there will probably come a time in my life where I will not be able to work full-time or be able to work at all. And it worries me deeply that our legislators would act so recklessly and so heartlessly to consider repealing the Affordable Care Act. It would really be a matter of life and death for me and for all of those who depend on medical care because they need it to live. So I'm here today to beg Congressman McCarthy to halt his efforts to repeal the Affordable Care Act. Please save my life, save the lives of so many others who have chronic, incurable illnesses. Thank you.
First of all, I want to deliver my message to all the Americans, people that are loyal to America, to Mr. Trump, to the Congress, Mr. McCarthy, and the people in Bakersfield. I want to tell everybody, stand for your rights. This is the Constitution. Everybody needs to stand for his own rights, especially when it comes to health care. Health care for us, it's a miracle. If nobody getting like real miracle, the health care and medications nowadays are big miracles. So what I want to say to Mr. McCarthy, we know you are very loyal to Bakersfield and California. We believe on you. You can do it because you're very loyal to our community. And I want to tell him our health is our wealth too. So if we not in a good health condition, we're not able to be productive. We'll not be able to do the jobs, and we'll not be able to work hard. Most of the people in California, they work 2 jobs. Anybody here work only 1 job? I don't believe it. most of the people work 2 jobs to pay their bills, the rent, and put some food on the table for the kids, right? So I think if you taking the health care away or medical, people are not gonna survive. It's gonna be a big revolution in America. Nobody can afford to have his medication paid from his own money, especially when it comes to money. There's no saving. The majority in California, they're not saving. Doctors saving a little bit to go their vacations, but the normal people, they cannot save for future, and nobody knows when you're gonna get sick. If you got sick, you got sick. Especially people with pre-existing condition like cancer. Before Obamacare, I think this is the good thing Obama did, the Obamacare, which is allowing people they have pre-existing condition to have insurance, which is before, if you have a job and you have a benefits and they cut you down and they let you go, and you applying for a like any private insurance, they will tell you, sorry, we cannot do that, you have to pay thousands of dollars. Some of the medication for cancer, it costs more than $10,000 a month. Who can afford it? Nobody can afford that, even if you have your own business. I've been working hard from like cleaning position. I finished my degree. I started working in the post office. I started working in engineering company in oil field, and they told me bye-bye. So what you gonna do if your medication is like $10,000, right? You can do nothing about it. So we glad we have the health care in California, in America, and we want to keep it, and we telling Mr. McCarthy, please don't take it away. The Congress don't take it away. Mr. Trump, you gotta have mercy in your heart for all your own people they elected you, or even they didn't elect you, because you work for them. You gotta be honest and take care of your own people. Thank you so much.
What we're doing today is very important. We're taking a stand, and I thank everybody for being here today, actually. I work as a full-time home care provider. I don't receive health benefits from my employer. I put it plainly, Medicare saved my life. I'm one of the millions of low-income adults in California who became eligible for health care coverage because of the Affordable Care Act. I'm right here today because my life is in danger. My health began to deteriorate 2 years ago. I am battling 2 non-curable diseases. I have pulmonary hypertension and chronic COPD. 2 long diseases, and I had never smoked in my life, people, never. I rely on oxygen, as you can see right here next to me, 24 hours a day since this past January. I've been trying to hold on not to use it, but unfortunately I got pneumonia early this year in January, and now it's part of my life for the rest of my life, 24 hours a day. I've been hospitalized twice this year, a week at a time, because of my conditions. Without doctor's medication to manage my condition, I don't know where I will be. But I know for sure I will be in constant pain and not able to breathe or walk. And Medicare has changed that for me. My mother, who's also a home care client, is completely bedridden. She's 85 years old and on dialysis. And because my own health is being controlled by my medication, I'm able to take care of my mother. I have promised her I would never put her in a home. And I'm abiding by my word as I'm taking care of my own health. Like many of you, I am terrified of what would happen if the repeal of the Affordable Care Act. Realistically, I can't afford my medication, I can't afford my doctors on my own, and I definitely can't afford my health insurance. I take more than 17 pills a day, 3 inhalers, and 24 hours oxygen to save my life. I'm a professional home care provider and a certified medical assistant for 32 years, and I'm still living paycheck to paycheck. I work and contribute to this community just like all of you. I deserve the right to afford my health care. I wonder if the people deciding whether to cut our health coverage have ever choose between putting food over their on their table, to the roof over their heads, or to buy that one medication that will save your life for that 1 month. To Mr. McCarthy and the rest of the elected leaders, don't take our health care. My life and so many of our lives depend on it. I thank you so much for being here today. This month alone, I didn't have coverage. I had to cut my medications in half so I can survive this month. So I ask all of you that can't, contact Mr. McCarthy. Let him know how you feel. We all need the CARE Act. Please don't take it away. We really need it. Thank you so very much for being here.
I'm here today because I've seen firsthand how the Affordable Care Act improves the lives of patients. We can't afford to lose the gains we've made. Working on the front lines, I am very familiar with the suffering that stems from the lack of access to affordable health care coverage. I've cared for people who, before the Affordable Care Act, waited too long to seek care because they had no insurance. Too many people came to the emergency room to seek care for a chronic illness that got out of control. I specialize in working with diabetes patients. Before the Affordable Care Act, I saw many patients who'd lost a foot or a leg because they could not afford to get the care or the supplies or the medicines they needed to stay healthy. Because of the Affordable Care Act, preventive care and early intervention is available. We don't want to go back to the past, where coming to the emergency room as the only means of treatment was a common occurrence. We need to keep the system in place that treats people early and in the right setting for less money. I have a message for Representative McCarthy. The lack of access to affordable insurance kills people. Because of the Affordable Care Act, the people in your district are leading healthier, productive lives. Don't take away our health care.
As you know, Medicare is next, and all of us seniors depend on that. It's affordable. As you know, it is run on about a nickel on every health dollar for our premium every month that's taken out of our Social Security checks, and that's their next issue that they want to take away. So we're going to help you, and we hope you help us. We're having a rally here on the 27th at McCarthy's office. They're coming statewide from all over on buses to let him know that we do not want Medicare to be voucherized. Okay? Anyway, the repeal of the Affordable Care Act will cause thousands of families in Kern County to lose access to health care. Our emergency room will once again be overwhelmed by people who would be better served by an urgent care or an office visit. Many will let their illnesses progress to the point where they can no longer be cured or treated. This is not America. In America, we are our brother's keeper. The heroes of our nation are not the ones who became mighty by sacrificing their countrymen. The heroes of America stand up for the common good. Our congressman is trying to rewrite the story of America, and we can't let him do that. California has taken enormous strides to connect millions of people with health care to prevent disease, promote health, and save families from the human and economic disaster that too often strikes the uninsured and the underinsured. If our congressman is going to do this to our families, he should at least have the courage to tell us what his replacement is, so everyone can understand how badly he plans to harm us. We will continue to fight for our health care.
Do you know that it is interesting that the United States of America is one of the few developed countries that does not have national health care, okay? One of the few developed countries. And with the Affordable Care Act, we actually were able to get closer to have a true National Universal Health Care Act. Now, by taking it away from us, we're going to go back into the dark ages, back into the dark ages. And when we think that all of these programs that we are fighting for, who pays for the programs?
We do.
Who pays for the programs? We do. That's right. Our tax dollars pay for these programs. For all of the programs of the government, we are the ones that pay for these programs. So when we are standing here today and we're saying to McCarthy and to Trump and to the Republican Party, we want you to use our money, our tax dollars for us, right? Not for the rich, but us, for the working people, the people that really create the wealth of this country. So the other thing we want to remind Mr. McCarthy, who pays his salary?
We do!
Who pays his salary?
We do!
Okay, and so we want those doors to be open. Now, my card for McCarthy, which I thank you for giving me this card, it says to him, McCarthy, don't be a Scrooge. Don't be a Scrooge. Keep our health care for all of us, the people that need it.
This is not about President Obamacare. This is about the Affordable Health Care Act that serves over 30 million people in the United States of America.
Yeah!
And it's very important, it's crucial, it's vital that we don't make it about politics, but we make it about the lives and deaths of people who can't have access to health care receive. In a district where over 50% of the constituency receives health care benefits as a result of the Affordable Health Care Act, we are praying that God will be with Congressman McCarthy as he considers the tremendous act that repealing health care would cause. We must pray that our leaders will consider the millions upon millions of lives that could stand to lose the blessing of quality health care. I think they talk a lot about the negatives. But what about the positives? In its very short existence, it's increased our access to health care. 22 million people have gained access to coverage as a result of the Affordable Health Care Act. It's also become affordable for citizens like you and me to afford health care as a result of the Affordable Health Care Act. The quality of health care has increased. We now can receive the same coverage or the same attention that those who have the resources to obtain coverage can obtain. It levels the playing field. And I don't know about you, but when we have an opportunity to be healthy, it changes the way we feel about ourselves and the way we feel about our community. You see, I believe as Americans, we have the God-given responsibility to care for each and every individual in the world, in the United States. And I think that if we can encourage our congressmen, our conservative brothers and sisters to walk a day in the working lives of our citizens, they would see it just a little bit differently.
Let's try and knock loudly one more time and see if they'll open the door. And again, the fact that they are not opening the door is a dereliction of duty. And he should be called on that too. Shame on them.
Shame on you! 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 Shame on you!
But we leave with this happy, healthy New Year message. The people of Bakersfield and your constituents are counting on you. Thank you so much, everybody. Thank you.